Hello, everyone. We are back. Well, not really back. We're still celebrating the holidays. I'm celebrating Christmas with my family and the new year. But we want to bring you some episodes, early episodes that you may not have ever heard. This one is one of my favorites. It's with Dr. Vindia Fernandez, who is a member of our Child Nexus professional community and a fellow pediatric neuropsychologist. She discusses neuropsychological evaluations through a cultural lens. I hope you'll enjoy the episode.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Welcome to the Diverse Thinking, Different Learning podcast. I am thrilled to have on our show today Dr. Vindia Fernandez. She's a colleague and a fellow pediatric neuropsychologist. Dr. Fernandez is the founder of the Center for Pediatric Neuropsychology. In her private practice, she is addressing the growing need for culturally and linguistically appropriate evaluations for Latino and Latina children. Dr. Fernandez is also a pediatric neuropsychologist in the Hispanic Neuropsychiatric Center of Excellence at the UCLA David Geffen School of Medicine. I am excited to dive into a discussion with her today. Welcome, Dr. Fernandez. How are you?
Good. Thank you. Thank you for having me. I'm really excited to join you on this podcast as well.
I'm excited to have you. And there is a lot going on right now. So I hope you're doing well. In addition to a pandemic, we're both in Southern California. So we're dealing with the smoke in the air.
Absolutely. And then distance learning, right?
Absolutely. And there's, of course, no challenge in that at all. Right?
Not at all.
Well, I want to dive right in. You and I are both pediatric neuropsychologists. We conduct neuropsychological evaluations. And in a previous episode, I broke down what an assessment for a child, adolescent, or a young adult looks like. But for many parents who are considering an evaluation for their child, they may have heard about a neuropsychological evaluation, a psychoeducational assessment. Can you talk a little bit about the difference between those two?
Sure. I'll start by defining what a psychoeducational evaluation is, because I think that's probably going to be the type of evaluation most commonly offered to parents in an educational setting if a child is struggling with certain aspects of the academic curriculum or their behavior. So a psychoeducational evaluation typically entails different psychological exams or tests that really serve the purpose of identifying different areas of academic need or differences in cognitive functioning that are contributing to deficits in academic functioning. And so the purpose of that psychoeducational evaluation is to inform education in various different aspects. So, for example, if a child is having difficulty mastering their alphabet or learning early academic skills related to reading or math, then a psychoeducational evaluation would be offered and potentially help identify some of those challenges the child is having, with the hope that this would facilitate some sort of academic intervention. So it's pretty specific for that goal in mind.
Right.
Whereas a neuropsychological evaluation, I like to think of a neuropsych evaluation as not being a specific type of evaluation, because there's lots of different kinds, but as a type of evaluation done by a neuropsychologist. And what defines a neuropsychologist is really the breadth of training. Right? So a neuropsychologist is a psychologist that has a degree in clinical psychology, but then has advanced training that's really medical in nature. You know, we have experience with neuroanatomy, and we work with neurologists in many different settings, although many of us do work in private practice like you and I do. And the idea is that that breadth of training allows us to be really flexible and adapt our evaluation to the needs of the child. So a kid could come in with academic difficulties, but we can sort of do an evaluation with a broader scope. So it's not just about the academics, but about figuring out what is contributing to those academic problems more broadly. Is it a medical issue such as ADHD, where really it's the inattention that is impacting a child's ability to focus on school? Or is it some sort of more broad neurodevelopmental disorder, like a language deficit or autism, or something else that perhaps maybe a child's parents or teachers haven't been able to really get a handle on. And then just above and beyond that, a neuropsych evaluation often addresses issues related to medical disorders a child can develop, or brain injury, where there's sort of like an interruption to brain development after the child has already hit certain milestones. So those are the main differences that I can think of between a psychoeducational evaluation and a neuropsychological evaluation. And it's with the understanding that a psychoeducational assessment is sort of embedded in that neuropsychological evaluation.
Right.
But it sort of has a broader scope, and it's defined by that breadth of training.
Yes. And I love that you did define it in terms of the training of the clinician, because again, a neuropsychologist and a clinical psychologist, they both have the same degree, but it's the advanced training in neuroanatomy and neuropsychological assessment and brain behavior relationships. And that training that occurs after they've already have the clinical degree in a postdoctoral fellowship environment. That's really what delineates the difference between those two. And I like the idea of the flexibility too, in terms of a child coming in for what might appear to be a psychoeducational assessment need, but then being flexible once you dive into the assessment to make a determination that something else might be needed or something else might be going on. So that really speaks to kind of the breadth and the broadness of the assessment process. And it also seems that when a psychoeducational assessment is conducted in the context of a school environment, the purpose is different than a parent who's bringing their child to you, for example, for a neuropsychological assessment or a psychological assessment. And the purpose of those assessments can be different.
Yeah, publicly funded independent educational evaluations specifically have a very, very narrow focus, which involves identifying whether or not a child meets criteria for an IEP, right? So whether they meet criteria for special education, and if so, what's the category of special education that they meet criteria for? Specifically, what areas of academic need are there, and how are we going to address those areas of academic need within the context of the educational system. And there are very clear legal mandates as to how you conduct these types of evaluations. And so in a way, you have to keep your focus very narrow. So when I conduct an IEE in my practice, those are some of the things that I have to keep in mind. School psychologists, on the other hand, who conduct psychoeducational evaluations, also have to keep those things in mind, but it's sort of embedded in the nature of their job, their role in the school district. It's a much more narrow focus, so the purpose is different. With neuropsych evaluations, the purpose is identifying sort of differences in learning, strengths and weaknesses, providing more broad recommendations for intervention that are related to that medical issue that you've perhaps identified. So we have the flexibility of diagnosing disorders that we identify, whereas in the school setting, you wouldn't necessarily do that.
Right. And I like that you mentioned the idea that you can make recommendations that go beyond the school setting. So if you're doing a neuropsychological evaluation or even a psychoeducational assessment in a private practice, you can make recommendations for things that the parents can be doing at home, maybe for additional therapies, things that the other caregivers, babysitters can be doing to support, overall well-being. So there are a number of different things that can be done and come out of it, even in the recommendations that you make as a result of what it is that you find.
Yeah, that's right. And I've always told my trainees, and it's something that I learned from my own mentor, an evaluation is only as important or as valid as the recommendations that you can impart on the family. Because at the end of the day, coming up with a good diagnosis is a good academic exercise, but if you're not actually helping to address the issues that you've identified, then it's not really going to be valuable to the parent. So I really believe those interventions and advice that you give the parents is really the most critical piece.
Absolutely. And that's why they're coming to you, because they are seeing a struggle and they want to know what to do about it. Right. And that's what the recommendations really are. And I love that you said that about the recommendations being so important, because they also have to be practical, things that the parents can actually follow up on given their own personal circumstances, what is available to them in terms of resources. That's also something that we often have to keep in mind as well, whether that means, occupational therapy or speech and language therapy, and knowing sometimes our hands are tied in terms of what can be covered by their health insurance and things like that. So we have to keep that in mind as we're making these recommendations as well, to support kids.
Yeah, absolutely.
So, a while ago, you wrote a really excellent article on dyslexia for the Child Nexus platform that was really informative. And I'm thinking about this now as you're talking about the evaluation process. And it seems that both the neuropsychological evaluation and a psychoeducational assessment both can uncover whether a child has dyslexia. But the neuropsych assessment is more comprehensive and could also identify other issues that could co-occur with dyslexia. Was that how you would put it as well?
Oh, yes, absolutely. I think that a good psychoed evaluation could identify deficits in reading ability and even identify the cognitive issues that underlie those deficits in academic ability. But at the end of the day, a child could have difficulty learning to read for lots of different reasons. One of them being deficits in phonological processing, which is really the hallmark feature of dyslexia. But I mentioned earlier, kids can have all sorts of reasons as to why they're having trouble in school. One of them being just difficulty with attentional ability, their ability to focus. If a child cannot concentrate on the reading material that's placed in front of them, they're going to have a hard time retrieving that information later on. If it's not getting in there, they're not going to be able to make sense of it or use it meaningfully in a discussion in class or answer test questions about that information. So ruling out difficulties with concentration is incredibly important. Also, more global deficits in language functioning can really underlie a difficulty with reading. So, for example, if a child at their age has not reached certain milestones in vocabulary development, for example, they may not be able to access all of the written material that's placed in front of them. If they can't identify the meaning of the words, then the sentence isn't going to make sense. And the overall theme of the story may not really make sense. And so they may have trouble with conceptualization and reasoning, identifying themes in stories, predicting motives. So, there's lots of different reasons for why a child may have problems in academic functioning. And so it's important to work with somebody that can tease all of that apart.
And really what you're speaking to, you're really speaking about, kind of the reason why a child is struggling, right? Identifying, you mentioned phonological processing, you mentioned attention. And obviously, if a child's difficulty with reading is tied to a phonological processing weakness, the treatment and the intervention and the recommendations you make are going to be different than a child who's struggling with reading because of an attention issue.
Absolutely. Completely different.
Yes.
So with a child that has deficits in reading that are due to phonological processing, the the common recommendation that I make is for that child to be enrolled in a pretty intensive, focused reading intervention program. And if a child has ADHD that hasn't really been adequately identified or treated, then that's going to be the number one recommendation. And then we figure out whether or not that helps. If it doesn't really help much, you have to do both.
Right.
Right. But with a language disorder, it's completely different. You're going to be working with like a speech and language pathologist, somebody who could really address that issue with vocabulary development. And then, as you already know, you often have to do all three at the same time.
Absolutely. Right. Because so many of the kids that we see have dyslexia and ADHD, or a weakness in their language processing and struggles with focus, attention, and distractibility. So oftentimes we are making recommendations to address both of the areas of struggle. And that when we do that, we have the best outcomes for those kids, because I'm thinking of a child who is struggling with phonological processing, like you've described, who also has an attention issue. If you're making a recommendation for an intense phonological processing program, but we haven't addressed the attention issues, then it's going to be very difficult for that child to even attend to the intervention if they have an unaddressed attention problem.
Absolutely. And so it's really important to try to tease these things apart as best as possible, but also to layer them and use these as complementary interventions when needed.
Yes. Now, we live in a state where there are multiple languages spoken. And I think to add to the complexity of teasing apart, what is contributing to the area of struggle, I wondered if you could talk about non-English speakers and the challenges that are presented when you're trying to identify neurodevelopmental disorders, neurodevelopmental struggles, perhaps those that are language-based in children whose native language is not English. And I'm thinking about dyslexia and the identification of reading disorders and reading struggles in those children. Can you talk a little bit about the challenges that it kind of presents and how to overcome those challenges?
Sure. I think to really understand why this is such a challenging topic, we sort of have to understand the history of this topic. Not everybody is completely aware that, in the olden days, for lack of a better term.
My kids use that term all the time and they mean the 90s.
I mean, before the 90s, like the 50s, and before then, I'm sure our parents would just cringe if they heard me saying that. But there was a time when we were assessing Spanish-speaking children with English language measures to determine whether or not they had intellectual disability and needed to be in special education classrooms, which at the time weren't really diploma-bound programs. And in those days, children of a Hispanic or Latino background were being sent to special education programs en masse. And something similar was done with the Black African American children, where the instruments that were being used weren't really validated for use with those children for lots of different reasons. The items that were used didn't have the same cultural meaning. And so what ended up happening was that for a period of time, minority or underrepresented populations were overrepresented in special education. And so there were lots of different laws that came out of those landmark cases which were brought out against the district. And there were lots of positives that came out of it. And one of them is that you actually have to use instruments that are validated for the population that you're working with. And so understanding how to conduct an assessment with a child of a different background, really starts with understanding the instruments that you're using and what they're being used for and how they were developed and who the data that the test was developed on really was. So when I get a child referred to me who doesn't speak English as their first language, or who didn't learn English first, but may now speak English as their more dominant or preferred language, my mind automatically goes into the instrumentation I'm going to use, whether it's appropriate for this child, whether the child can meaningfully participate in an English-only evaluation, and how I'm going to be communicating with the parent, what the parent's context is for participating in these types of evaluations. What many people don't know or don't think about so much when they interact with immigrant parents, for example, is that in their home country, they may have not had exposure to formal education, and interactions with professionals may be really negative. They may not have the type of trust that one has here in the U.S. because either education is compulsory or access to medical care is available to all or should be available to all. But those interactions are going to be very different with a professional, especially one that doesn't share that same culture. So they may not open up as much, or they may not be able to complete the questionnaires because they don't have the literacy level required to complete certain questionnaires. So, I think it starts with the parents. It starts with figuring out how much exposure the parents have to education, and what the home language is, whether the child has siblings that are already exposed to the English language, how long they've been in the country. There's so many different variables that you think about before you even start an evaluation with the child that's not either English speaking or who didn't learn English first, right? So it's a very, very complex issue. But all of that happens in my mind even before I see the child.
Right.
Once I start to think about actually evaluating the child, it's a whole other can of worms.
Right. You're really taking into consideration. I mean, we should do this anytime we're doing an assessment, the cultural context, right? And the family background and developing rapport is so important, particularly when you're dealing with communities where there might be mistrust and there might be, differences in the way that they have experienced the education system. So those are all things to keep in mind as we're interacting with families and children, because even though the evaluation is for the child is living with the family. And so we're really interpreting the results in the context of the family and their culture.
Absolutely. And don't you feel like even with English-speaking parents who just always lived in the U.S., that psychological mindedness, their knowledge about how psychology works really affects the type of data that you get? Absolutely.
Absolutely. Even the willingness to share. Because, one of the things we do is we collect background information. You mentioned the background questionnaire, and some will be extremely detailed where they've get extra sheets of paper and they're elaborating on things, and some will be blank. Or, I'll just have a couple checks. And so that's where sitting down with parents and having that conversation and again, developing rapport, developing trust, explaining the reason why you're asking these questions. I'm not just trying to be nosy. There's a reason why this is important, and explaining why you're asking the questions that you are. That can also be extremely helpful in terms of helping families open up with information, particularly when you're thinking about family history and there are language-based issues, attention issues that have a genetic component. You're more likely to have struggles in the areas of language or attention if you have a family member who struggled in that way. And so knowing the reason why we're asking about family members while we're asking about, mental health and anxiety and depression, because we also know that some of these issues that we think are related to learning could also be related to anxiety or sadness or some other social emotional factor. And then we have to tease that apart too, as you mentioned teasing things apart.
For sure. Absolutely. And just to kind of take it back to the historical context briefly,
Yes.
I think as a society, we're actually more aware of these different variables than we used to be. But what's happened is that the pendulum has swung the other way. So I think right now what's happening is we're all hyper aware that language can contribute to differences in how children interact with the academic setting. And sometimes we're over attributing some of the difficulties to the culture and language, when in fact there's a true disorder there. And so those differences, or either learning differences or disorders, are being under-identified because we're trying to be sensitive to the language and the culture. So being able to address those needs really does require a cultural lens, and also just that fundamental knowledge of what the disorder looks like in that population, and being able to use adequate instrumentation. So it's a complicated issue for sure.
It is. It's definitely not something that we can talk about in 30 minutes and get it all covered. But it's a good place to start, because I think one of the important things you said is that some kids can get missed because they attribute difficulties with reading or difficulties with language to the fact that English was not their native tongue, or English isn't spoken in the home, when in fact there could be a real language-based issue, either a difference or a disorder. And we also know that early intervention is so important. So we don't want to miss those kids, because we know that as they get older, that gap just widens between them and their peers. And we want to intervene early and not miss those kids, and not get them the services that could really help them be successful.
Absolutely. And, I think there are some myths out there that perpetuate this difficulty. One of them is that bilingual children automatically have a less developed vocabulary when they learn the two languages simultaneously. While that is true in a subset of children, most children who are learning or exposed to Spanish or another language in the home, when they're introduced to English-only instruction, usually catch up to their monolingual peers very, very quickly. So within 3 years, we usually see that gap close. And so it's really those kids who beyond the second grade are still really struggling that we need to start monitoring. That doesn't always get done. So it's really important, I think, that we're aware of what that normal trajectory looks like for bilingual children, and when do we start to get worried.
Absolutely. And we see that too in even monolingual kids who come from, impoverished backgrounds or lower socioeconomic status. Oftentimes the difficulty is also attributed to, not having someone in the home who can support their learning, or coming from an impoverished background. And then they also are in that position where they don't get the intervention that they need, or because they come from impoverished background, there might be some things happening in their community that contribute to, or in the home that contribute to behavioral problems. And then when a child is really struggling with learning, all educators might see is the behavioral issue, and the behavioral issue might be their way of responding to their own difficulty with learning. And then the learning issue never gets identified, and they just get treated for a behavioral challenge.
Yeah, absolutely. And I'll be the first one to say that we should not overpathologize differences in learning, especially when we're talking about children who may grow up sort of differently. They don't have the prototypical American experience, right?
Right.
But really working with this segment of the population requires an intersectional approach and a multicultural lens. So, it's really important that all professionals who are working within this context, especially in places like Los Angeles that are so diverse, really have that competency when they decide to work with these types of kiddos.
Absolutely. Because again, you don't want to overpathologize, and you also don't want to miss any kids who really need services and support in order to access their curriculum, in order to, just have a good experience in their educational setting and be able to learn in that environment. So again, it's very complex. It really is very nuanced, and it really takes individuals like you who can tease those issues apart to ensure at the end of the day that a child is getting the support that he or she needs in order to be successful. whether that's success academically, social emotionally, their overall well-being. I mean, we really don't separate those things because they're all part of who the child is.
Absolutely.
So I know we've talked about a number of different things about a neuropsychological assessment, the psychoeducational, the challenges of doing these kinds of evaluations in kids who come from different backgrounds, who are non-English speakers, who have non-English speaking parents in the home. So when people come to see you, what are some of the things that they are struggling with? And when should parents consider a neuropsychological evaluation?
The types of kiddos that I see are typically the ones who are struggling in school for a variety of reasons. Usually it's for problems with concentration. Sometimes it's because children are having trouble making and keeping friends or are having trouble following instructions. And really, anytime a child appears to be acting or feeling or performing very differently from their peers, and it's very hard to understand why, those are usually the types of kiddos that come to me.
And I love that you mentioned performing differently from their peers, because I think that becomes a struggle for a lot of parents and educators, because there's kind of this line that can be crossed between you have a language-based disorder, you have a learning disorder, and you have a learning difference. It's just difference in the way that you learn. And oftentimes not knowing which it is can be confusing to families. Because again, we're all different in a lot of different ways. You've got kids in the classroom who do really well in reading comprehension and have a little more struggles with math, but they may not have a math disorder. And you may have kids who are excellent in math, but struggle a little bit more with writing. And so when is it a language-based disorder, a specific learning disorder in a particular area? And when is it a difference that kids might grow out of?
I think that's a tough question to answer, but I'll give it my best shot. I think that that's why we need professionals to examine the child. But really, it's when there's a level of distress associated with that learning difference that no longer can be accounted for by typical development, right? So, for example, if a child is having meltdowns at school and they're telling you they just don't know how to write certain letters, or they're completely disengaged and they're missing large chunks of information and are so disorganized that just getting through the academic day becomes a challenge. Those are all red flags for me. And I think it's important for parents not to ignore their gut feeling if they feel like their child is struggling more than they really should be, and it's becoming a bit of a burden to the child, either emotionally or otherwise. Those are all really important red flags that we need to pay attention to, because these are problems that you really want to nip in the bud. Kids with attentional difficulties and learning disabilities often have higher rates of anxiety and depression, and can go on to develop delinquency in high school and whatnot if those issues aren't really appropriately addressed. These kids really need a lot of help and support, and can't just be expected to catch up. So one of the things we know is that if children are really, really lagging behind, if we're dealing with a disorder, the gap between them and their peers isn't going to magically close. In fact, the opposite is true, that it's going to keep growing and growing until it's really, really hard to catch up on your own without lots of stress, lots of intervention. So that's what I would tell parents. Don't ignore that gut feeling that you have. If you feel like your child is struggling more than average, and the distress is there, the anxiety is there, that's usually a good sign you might need an evaluation.
Wonderful. Thank you so much. That's really helpful. I think that will be helpful to a lot of families who may be seeing their kids struggle, and they may even be seeing some levels of distress. And this is really helpful in determining, when to seek out some additional support, some additional answers, and that might be an evaluation to determine the root cause of the struggle. So thank you so much for sharing that. And I really appreciate you just sharing your expertise with us, Dr. Fernandez. This has been so helpful, and I think it's going to help a lot of families. And I just want people to be able to reach out to you and connect with you if they want more information, perhaps a consultation or an evaluation for their child. What is the best way for families to get in touch with you?
If families would like to get in touch with me, I suggest they go to my website. It's www.pediatricneuropsych.com. Sort of a mouthful, but it's pediatricneuropsych.com, and it's PediatricNeuropsych. Or they can always just give me a call for a free consult. The number is 424-255-6388. Again, it's 424-255-6388.
Perfect. Thank you. And I will also put that information in the show notes with a link to your website and that article that you wrote on dyslexia, which I think is fantastic. So again, thank you so much for coming on the show and sharing your expertise and your insights with us. I think it's incredible and informative and helpful to a number of parents who are looking for answers. So thank you.
Thank you for having me. It was really great connecting with you in this way, and I do hope this information helps.
Wonderful. I hope you enjoyed this discussion with Dr. Fernandez as much as I did. Please share your thoughts about this episode with me. And of course, if you know someone who would benefit from hearing this episode, please share it with them. Thanks so much for listening.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.